Thank you for such a great turnout today. Hello, everyone. My name is Alison Hamilton, and I will be leading this session today on writing an implementation research proposal. Thank you so much for joining. I'm doing this on behalf of the UCLA Rapid, Rigorous, and Relevant Implementation Science Hub, which is based at UCLA, of course, in CHIPS. And just want to thank Elena for all she did to help set this up today, and my wonderful hub team for supporting our efforts. And there'll be a little bit more information about the hub toward the end today. So just by way of background, I'm a professor in psychiatry at UCLA and also the Chief Officer of Implementation and Policy at the VA Center for Innovation at the VA Greater Los Angeles. And I do implementation research on both sides of the street. And I write a lot of proposals, and I help people write a lot of proposals. And I really like thinking about how can we write effective proposals in general, and then how can we write effective implementation research proposals specifically. So that is going to be our topic for today. Just so you have a sense of how this is going to flow, I have a good hour of material, probably a little bit more. But I will take breaks periodically to check in on the chat. So feel free to put your comments and questions there, and I'll do the best I can to answer them in the moment, or if there are things that you want to talk about later when we have more discussion time, that is also fine too. So Elena's gonna monitor that. I can't see the chats as they come in, so I'll just pause and ask her to share any questions or comments every so often. We are this is a 2-hour session, so we will take a break when it feels right to take a break. I can't say exactly when, probably roughly an hour in, maybe a little bit more, you know, just so everyone can get up and stretch and take a break from the screen. The slides will be made available. That's probably a question that's going to come up. So we'll make the slides available. Elena, probably folks will need to email us, or we can send them to everyone who registered. But we'll tell you at the end how we'll distribute the slides, and we'll also be posting them on our hub website when that is live and available. So we can make the slides available. Am I forgetting anything, Elena, before we get started?
Nope, that's great.
Okay. All right, so off we go to talk about implementation research proposal writing. So there are, hang on, let me make sure I can advance here. So there are going to be some key pieces that I'm going to be mentioning a lot today, and I really, really strongly encourage you to take a look at these. Thankfully, the good news is if you're starting to work on writing a proposal, there is a tremendous amount of guidance available. So I'm going to be talking about the Bronson paper and the Proctor paper quite a bit. All three of these papers are, in my mind, absolutely critical reading if you want to have great guidance for how to write a proposal like this. Russ Glasgow did a talk that's available online that I also recommend. You'll see lots of similarities between what he says in that talk and what I'm going to say today. There are sample D&I grant applications available through the National Cancer Institute. I highly recommend taking a look at funded D&I grant proposals, and also the Grid-Enabled Measures, or GEM database, which is also hosted by NCI and has just a treasure trove of measures. And they're organized and findable by constructs. So we're going to come back to this, but I just wanted to get some key resources and readings available to you. And then there will be some additional citations and so forth, other resources, online resources as I go along today. But these are going to be frequently mentioned throughout the course of our time together today. Okay, so I'm not doing like a whole what's implementation research and kind of 101 D&I, dissemination and implementation research. I'm really kind of taking as a premise that if you're here thinking about writing an implementation research proposal, you likely have some knowledge of why you would be doing that and what that would mean. So of course, if there are more fundamental questions that you have, please feel free to ask them. But I am kind of starting from that place of folks having a working knowledge of implementation research, which generally speaking is meant to increase the uptake of evidence-based practices and other practices into routine care, healthcare related implementation research, that is. And that has that early definition from implementation science back in 2006 has definitely evolved. So now, for example, we look at things like de-implementation. So not only trying to stand things up that are effective and demonstrated to be effective, but also taking things away that are demonstrated not to be effective. We think well beyond evidence-based practices, and I'll talk about this in just a little bit. There are lots of different things that we're trying to put into place or take out of place. And that is really the effort in implementation, is to increase the quality of care by ensuring that that care is delivered in the most evidence-based way possible, using strategies to help support that. So that was just my quick little overview of where we are with what implementation research is. Elena, is there anything in the chat in this early moment that I should address, like technical or anything like that?
I can just say, just a few folks have been asking about what will be made available after the session. And so I know that we will be making both the recording and the slides available. And within the slides, all of these live links that you're seeing should be available. So I think that's it for now.
Okay, thanks. I just see the chat kind of lighting up. So I want to make sure there's no like people can't hear me or something like that. Okay, thank you so much. Okay, so when we think about writing implementation research proposals, we really want to think about what are the critical components that you're going to need to impart in that proposal. So we have a few things to work through now, and what you're going to see here in the brackets are key ingredients, and those are taken from the Proctor paper that I just cited, where she and colleagues talk about the 10 key ingredients for implementation research proposals. So the points that you see here are points that I use when I teach implementation science more broadly. And what I did is in brackets list all the different ingredients that are mentioned in that Proctor paper. First of all, to double check that I covered everything, but also to give you a way to map back to that paper, you know, as you're working through your proposal writing. So to get us going in implementation research, there is a problem, right? We're doing this work because there is a care gap, a quality gap. There's something that needs to be changed. And that's kind of at the foundation of this type of work. We're trying to improve something. We're trying to change what people do, what's happening, how people do something, how organizations do something, how communities do something, et cetera. But change is really at the heart of these types of initiatives. So you want to be really clear on what that gap or problem is, and it might take some time to really refine a statement of what that problem is, and we're going to talk about that. You also need, all of these things will be explained throughout today. So this is sort of an overview of what we're going to talk about. You also need a theory about how you are going to go about fixing that problem. That corresponds to Proctor's key ingredient of a conceptual model and a theoretical justification. We're going to talk about this. So this is where we say, well, it's not only I have a problem, but I also have a theory, a working theory about how I think I am going to be able to change that problem. How am I going to be able to fix it? And, you know, we start with our theories and then we do our work to see if our theories of how change would happen actually hold up and guide our process. That's a very critical component of these types of proposals. Not only if you don't have it, will it be a problem, but if you have it and you don't use it consistently and thoroughly in several different components of your proposal, that will be seen as a key weakness. So you can't just kind of say, we're going to use the consolidated framework for implementation research and you have a little paragraph about it and then you never see it anywhere in the proposal again. That's not going to be sufficient. So we'll talk about really why do we need this, How do you go about weaving this in? Where can it come up? We need ways of addressing the problem that we're focusing on. So we need a study design, and that needs to be feasible. We have some type of intervention that could be a program, a policy, a practice, etc. We'll talk about those in a minute, but there's the thing that is going to actually change what needs to be changed, and then strategies. So we need those supports to help make the changes that we want to make. We need a process that helps us to address the problem that we're trying to fix. I would highly, highly, highly encourage that you select a phased process so that you know what you're doing when, at least roughly you have a guide for how to phase the work that you're doing. A couple of key ingredients, if I see I have a little typo there, a couple of key ingredients from Proctor's paper also include understanding stakeholder priorities and stakeholders' willingness and readiness to engage in change, and the setting's readiness to adopt something new. So it's not only are the people ready, but is the place, the organization, the clinic, the setting ready to do something new, and what evidence do you have for that? So maybe you have some preliminary studies that you've done that indicate the readiness and buy-in of your stakeholders. A lot of different ways you can go about this, but these are important issues to speak to in your proposal. You need to evaluate. That's a big part of what we do in implementation, is implementation evaluation. So you need a way to evaluate your process for addressing the problem. And you're going to need to be able to reflect on what your process was. So it's very key that you specify and articulate what that process is from an early point. And of great importance with your process are feasible methods and measurement and analysis plans. So the difference between the first big bullet and the second one is we need to know the process of how things happen, but we also need to know the outcomes and the impacts of what happens. So we have to ask that critical question of how do you know that you changed what you wanted to change? What we look at in implementation research are not only effectiveness outcomes, which sometimes we don't even look at anymore, depending on your design, but we also look at implementation outcomes. So it's very important that you specify in your proposal what implementation outcomes you're going to be addressing, and perhaps which ones you're not going to be addressing. You need a team. This is not to be underemphasized. You need a team, usually a multidisciplinary team, a team with a lot of different skills and backgrounds. You may have some team members that are very familiar with the setting, others who are familiar with a particular treatment or program, others who are familiar with the process. You may have subject matter experts and implementation scientists, people with social science backgrounds, people with epi backgrounds, clinical backgrounds, public health backgrounds. All of these different folks come together to do this type of work, and you really can't do it alone. You have to have a team. It's a team-based effort. There's too many things that we can't possibly know as individuals that really require that team-based orientation to this type of work. So you'll often see that implementation, successfully funded implementation proposals have multiple PIs, as long as that's an allowable mechanism, because there's really needs to be different leaders of this type of work coming together and taking on what are pretty substantial challenges from a research perspective. And then you also need to have a solid understanding and articulation of the policy and funding environment. So we're going to get through a lot of these things. If you want to just recap this in a way that I think is total genius from Jeff Curran, we can think about, do I know what the thing is? What is the intervention, the practice, the innovation? That's the thing that we're using. Now, we might be engaged in some effectiveness research in our implementation project, and that looks at whether the thing works. The implementation research looks at how best to help people and places do the thing. That's what we're really focused on in these proposals. The strategies are the stuff that we do to try to help people and places do the thing. And the main implementation outcomes are how much and how well they do the thing. So as you're working through your implementation proposal, you want to think, do I know what the thing is? Can I clearly articulate that? And that's not as easy as it might sound. Sometimes we're not totally clear on what our actual intervention is or what the parameters of it are. It may be multifaceted, it may be multi-level. So having a very clear explanation in your proposal of what the thing is pretty much the heart of these proposals, because that's where the focal point is. What are you putting into place or trying out that you think will achieve the change that needs to be achieved in order to close that quality gap? If you say, well, I don't know if what I'm interested in is actually ready for prime time. Is it ready for implementation research? And I think this is such a helpful and clever way of thinking about where you are on the so-called subway line of translational research. According to Megan Lane Fall and colleagues, really, I highly recommend this paper to think through, where does my work fall? Where does my intervention fall? Hendricks Brown and colleagues wrote a paper about the 7 Ps, and this is what I was referring to before, that we're at a stage now in this type of work where it's not just about implementing an evidence-based practice. We also have implementation of programs, principles, procedures, products, pills, policies. And so that is that sort of umbrella term or way of thinking about all the different things that we might be trying to implement in implementation research. So in this paper, they call it the practice of interest. And this really helps you to think through, again, are you ready for implementation research? If you don't have efficacy, then you may need to take that red road up to efficacy research. If you do have a demonstration of efficacy, then you might be moving into effectiveness and looking more at external validity. And then you got a few different pathways here. Maybe you don't have the established external validity of your practice of interest and you need to do more effectiveness research. Maybe you have some, but not a lot. And so that might move you into hybrid designs, which I'm going to be talking about today. And then if you have a strong demonstration of effectiveness, there might be other types of implementation work that you do, particularly with regard to developing and refining your implementation strategies. So not every practice of interest or one of these 7 Ps is going to take you to implementation research right away. There may be some early preliminary work that you need to do to put it on this subway line to implementation research. Okay, so let's say you've established on your subway that you are ready for implementation research, and you say, how am I even supposed to start this? What do I start with? For me, whether it's implementation research or any other type of research, you really have to clarify your research question. So what is the question that you are trying to answer with this project? And that, again, is similar to your intervention. It's not just like the easiest thing in the world to come up with your research question. You really need to probably hone in on that. You may need to refine it. Different members of the team may have different ideas about what the research question is. So when you get to that super clear articulation of the research question, that's probably what's going to show up in your specific aims. You want to think about what it is that you are trying to change in the near future and in the distant future. There's that long-term goal in which your project is a piece. How does your piece of that big picture, 10-year goal fit? How does it move you in that direction? And the way that I like to go about working on this type of thinking is by using a logic model. So I would say the first couple of things that I would do are start to draft a research question, be really clear about what it is I'm trying to change, and start at a very early time working on a logic model. So I'm going to take us through logic models, and then I will pause and see if there are some questions or comments in the chat. So the logic model is your friend. It really should be your friend in implementation research and in any type of research that involves change. And I've just found over the years of using logic models, now I can't design this type of work without logic models because they help As this quote says, they help to give you this visual of how the study is doing its work. What are the assumptions underlying the study? What are my different outcomes, and how do those relate to activities and theoretical assumptions? So there's a lot. Not only does the logic model give you a way to kind of parse out all the different pieces of your proposal, it also gives you a way of developing your team. So it has this other side effect of not only giving you something to guide the work, but it also helps to guide the team in beginning that group think about what is happening, what are we trying to achieve, what's happening where. So I highly recommend doing this thinking with a logic model very early in the process and using it very often for those team meetings as you're doing the writing. It will definitely change from the first day that you set it up to the time that you feel like it totally represents what we're doing. There's, different perspectives and approaches as to whether the logic model actually makes its way into your proposal. Some funding mechanisms will require it. So if they require it, you absolutely have to use it. But it might be that you're going to present a distilled version of a very elaborate logic model. So there's all kinds of creative ways in which you can think about where the logic model shows up, if it does. But even if it's not required and you don't end up using it for the final submitted proposal itself, I still recommend using it to guide your process of writing the proposal. So this is sort of a classic bare bones logic model that for those of you who have a background in public health, it's going to be very familiar. I think probably the best advice I ever got about designing a logic model is that you start from the far right. So you really think about, if I do what I really want to do in my life for the next 10 years, I am going to affect this particular change. That's usually not the change we can achieve within the funding parameters of a 4-year project, a 5-year project, a 3-year project. But you want that big picture of like, what is this really about? And I'll give you an example in a minute. And then you work your way backwards to, okay, how am I going to get there? What are my short-term outcomes? What are my longer-term outcomes? What are the changes that I want to be able to achieve in order to get to that very big picture impact? What am I actually going to generate that will bring me to the outcomes? Those are the outputs. What am I going to do to get to the products? Those are my activities. And what am I starting with? So am I starting with, lots of different human resources, financial resources, organizational resources. For example, you have buy-in from the clinics where you're going to do your implementation research. You have a lot of preliminary studies. So that's everything that you start with. And I've seen some logic models that actually build in an assumptions column too, where you start with what are your theoretical and conceptual assumptions that drive your logic model. Now, there's been a very recent paper by J.D. Smith and colleagues that is the implementation research logic model that you see cited down at the bottom. This is an absolutely, in my opinion, a pretty mind-blowing resource for the field, because not only does it explain how to complete an implementation research-specific logic model, but it also offers you a fillable template. And I know many of you are involved in funding mechanisms that request use of that particular logic model. So it's going to be a much more specific look at the components of your implementation research. It might not contain all these other dimensions of a logic model, but it has a very, very practical guide to filling out a logic model for your implementation research components. So I highly encourage you to take a look at that amazing paper and resource. Now, this wasn't around a few years ago, unfortunately, when I had to make a logic model for an R01 implementation study. So this is the sample logic model. It's not complete. I put it in an incomplete version just for illustrative purposes. So this was pre J.D. Smith's paper. But this was a study, and you'll see me come back to this study a couple times, where we were, our goal was to implement an evidence-based, couples-based treatment model for HIV serodiscordant couples in community-based settings. And so we wanted to take an intervention that had been demonstrated to be efficacious in a multi-site study and do community-based implementation of the treatment model called EBON. And so this was the logic model, piece of the logic model that I used as we were working on the proposal. So we said, okay, what are we starting with? Community-based inputs. We have letters of interest. We have referral sources. We've done a lot of strategic planning. We've got a lot of structural inputs already in place, and those are going to contribute and feed into our activities. What's important to note about how I set up the activities here, how the team set that up, is that each box represents a different phase in the model that we used, which I'll show you a little bit later. So you can, I mean, this is kind of bare bones. You can get very creative with these. And it may be that not everyone on the team has the expertise to design logic models. So it's great if there's someone who has a little bit of a background in this or who wants to pick up the skill, because you do kind of become the resident logic model expert. What's nice about setting it up this way, according to the phases, is that you can really think about what are going to be the outputs of each of those phases. So what am I going to have after the training phase? Well, I'm going to have 2 trained agencies. I'm going to have X number of trained facilitators. I'm going to have a certain number of agencies on board. I'm going to have collected readiness surveys, for example, and those are all going to lead me to proximal outcomes. This is the logic of it, right? This doesn't reflect what actually happened. This was the logic of how we planned for everything to happen. Did it happen according to this exactly? Definitely not. But that's, you know, that's what happens when you actually do the work, is that you see, okay, we started here, this was our plan, and what did we actually achieve? But it's a great way to look back and see what did we think was going to happen, and to what extent did the actual implementation reflect that. And you can see our longer term outcomes with this project were to increase organizational capacity for people living with HIV and their partners, and to reduce seroconversion. Are we going to see that? Maybe a little bit of that in our project, but that's definitely sort of our bigger picture long-term outcome. So a huge fan of logic models from a very early stage, when you're just starting to think about what is this proposal going to look like. And you can just keep it as a very living document, filling in pieces as you go along, making revisions as you go along. And it's a really nice way to have an at-a-glance guide to where you are in the process of figuring out all the details of these very complex proposals. So I'm going to pause there and see if there are questions or comments that I should address now in the chat, Elena.
Sure, yeah, so we actually just have 3 questions in here that all relate to efficacy. So
Okay.
we might kind of want to go back just a couple slides. The first one has to do with Dr. Curran's great explanation with all of the things. So we have a question saying, I'm accustomed to seeing efficacy rather than effectiveness for the intervention and effectiveness in the real world implementation strategy. Thoughts?
So I think of this, I'm a bit of a traditionalist when it comes to this question, and others may think about it differently, of course. When I think about efficacy, I think about historically, the traditional way that we would go about establishing efficacy in some type of experimental design. So we know randomized controlled trials are, considered to be the gold standard, although there are many, many critiques of that model at this point. But the efficacy in this way of thinking about it relates to the demonstrated outcomes in a very controlled type of study, and focus on internal validity. And then when we say, okay, well, what about when we loosen up all those parameters, when we take away the controls, when we take something that was tested in this highly controlled way and move it into highly uncontrolled settings? We loosen up all those parameters around it, and we look at the effectiveness. We look at how does it work in this different setting, or with this different population, or with this different approach. Still the same intervention, but we're going to use it in different places and spaces with different people, then we're starting to expand out into external validity. And so oftentimes when we're moving into implementation research, that efficacy has been established. And now we're going to say, what can we learn about effectiveness? And then there are designs that help us to either maintain most of our attention on still establishing effectiveness, or maybe you've got a fair amount of effectiveness data because you've tested it in maybe some different settings or with some different populations. And so then you can use other designs to maybe look a little bit more intensively at implementation and less at effectiveness, because the effectiveness ostensibly has already been established.
Great.
That was a short answer to an important and complex question.
Yeah, no, absolutely. That was a great question, and thanks for that response. We actually have, I think the other two questions relate to this slide you're on right now. And the first is, how much efficacy research is necessary before moving on? So I think kind of before moving forward in this decision tree.
Yeah, I mean, I think, the way I would have answered this question even 5 years ago is different than how I would answer it now, because I think we've seen a lot more opening up of standards for when something is ready for implementation. I think that's where the opening up has happened. Not so much, we don't care about efficacy anymore, but can we have a broader understanding of when something is ready for implementation? Because evidence in the stricter terms of the word can be, we know it can be very biased, for example. We know it can be really restrictive and limited, and only certain people were included in the trials, or it only happened in certain settings. And we know there are a lot of disparities related to that. So I think that the field in general has opened up to a much broader idea of when something is ready for implementation. Some of the things you see on the left, the 7 Ps, are not necessarily evidence-based in the sense of having gone through that efficacy-based RCT standard, but rather maybe there are community-based practices that have been demonstrated in other ways to be effective for that community. And we want to look at implementation of those practices, or guidelines. For example, guidelines come from a very complex process, and we may want to look at guideline implementation. So it's really changed, I think, which is a great development, in my opinion, in the field. And so different disciplines are going to have different standards for efficacy. I think another thing that we're seeing in designing for implementation, as you see in the subway there, is that even now, when folks are doing like clinical trials, there's much more infusion of thinking about implementation from the beginning. So not saying, well, we'll deal with those implementation questions, after we've done a 5-year trial. It's saying, let's really move forward our thinking about implementation from an early design trial phase, so that when it comes time for implementation, we've already put some thought into that. So this is a very much moving target in terms of, any one answer. I think it's something that's really evolving, and it's evolving in really exciting ways to kind of open up what we think about in terms of efficacy and readiness for implementation. What I would say is, when it comes down to like, well, should I apply for, implementation related to my particular program or intervention, look really carefully at what the standards are in that RFA, and talk to a program officer, talk to them about what you have in mind to do. Can you make a strong enough case using whatever evidence is available to you for the viability of that program or intervention to go into implementation research? So there's not one like perfectly great answer to that. Rather, it has a context, and it may relate to what the expectations of that RFA are. They may even be interested in things that are less, I don't like using the term rigorous here, but they may be interested in programs other than those that have been tested mainly through RCTs.
Thanks, Allison. And I'll just note that Dr. Glasgow mentioned in the chat that he agrees with you, and also, which is great, and also mentions the importance of asking effectiveness on what, or effectiveness related to what, so equity, impact, sustainable results, etc. So I think that's an important point. I'm not sure. We do have a few more questions here in the chat. Alison, do you want to continue with questions, or shall we save them for the end?
I think I better keep going for a little while just based on our timing. So I'll keep going, and thank you so much, Russ, for those comments and for being here. And then we can come back to some more questions after a little bit more content, because there's still a decent ways to go with
yeah,
the
sounds
content.
good.
Okay, thank you, Elena. Okay, so we're past our logic models. Okay, so now we really want to think about developing those research questions, which then become articulated in your specific aims. If you haven't read Jeff Curran's paper from 2012 about hybrid designs, it's about much more than hybrid designs. It is, again, essential reading as far as I'm concerned in the field, and they do a really nice job there in talking about sort of a typical progression of questions that we might ask as we start to design our aims and our proposals. So again, we're thinking about what are we trying to change? What can we do to address this problem or this challenge or this gap? Is there an evidence-based practice, program, policy, et cetera, being used? If it's not being used, why not? A lot of where this field started was in poor uptake of evidence-based practices because they were tested under these really limited conditions, but then, you know, folks who weren't using them in everyday practice. And that was, you know, one of these big gaps that the field has been meant to solve. How can we do a better job of moving these practices into routine care, into routine use, and why aren't they being used? What can we understand about barriers and facilitators to the lack of use? We want to understand what influences the use of an evidence-based practice, et cetera, practice of interest, and what can we do to facilitate its use? And how are we going to know that what we've done is effective? So that's really looking at your outcomes. So here's an example of specific aims from that same R01 that I mentioned a moment ago. Our question was, how do we get an evidence-based intervention into place in community-based organizations that care for clients with HIV and their partners? We set this project up. This was funded many years ago by NIMH. One of the first implementation R01s, gosh, probably now about 7 years ago or so. Gail Wyatt was the PI, and we set it up as a hybrid type 2 study. So what we wanted to do in the aims, obviously this isn't the whole aims page, but what we wanted to do in the aims, because it was hybrid type 2, with a balance between attention to implementation and attention to effectiveness, we wanted that to be demonstrated in our setup of the aims themselves. And we were intentionally put the implementation aims first, because that was where the majority of our attention was placed, was on implementing this intervention for couples and community-based organizations. And we said to employ a theory-guided strategy to partner with the community-based organizations to expose providers, facilitate adoption, and sustain its use. These are all the terms in italics are from the model that we used. And to use mixed methods to document the implementation process and identify barriers and facilitators to adoption, fidelity, and sustainability. Those are what we think of as the implementation outcomes. But we also at the same time had an effectiveness component to this study, where we wanted to evaluate the effect of this intervention on behavioral and biological outcomes. So that's that piece of just saying, you know, is it still going to work once we move it into these community-based organizations and change up a lot about it, you know, how it's going to happen in these different contexts, excuse me, et cetera. We didn't feel that there was enough evidence to say that we're not going to pay attention to effectiveness. So we still really wanted to see how does it work in these settings. in terms of those outcomes and how does implementation work as well. And then we had a secondary aim of determining the cost effectiveness of implementation. This is another example of aims from a VA-funded implementation program that I and my colleagues lead, called Empower, funded through the VA Quality Enhancement Research Initiative. And our question here, our driving question, was how do we get evidence-based care into place in VA women's health and facilitate women's engagement and retention in that care? This looks really different from the prior example. I wanted to give you two very different ways of working on aims, and there are many other examples as well, especially if you go look at those publicly available funded implementation proposals that I mentioned before. So here what we proposed to do was use an evidence-based implementation strategy. You'll see this come up later, that emphasizes local tailoring of care models, multi-level stakeholder engagement. We were using in AIM 2 some words that were very prominent in VA policy at the time related to personalized, proactive, and patient-centered innovations. And we were looking at a variety of outcomes: acceptability, feasibility, satisfaction, relevance, effectiveness. And our third aim was actually a kind of a product-oriented aim to generate implementation playbooks for our operations partners. So really different setup here. This was more, it's different in part because of the way the RFA was set up. Just different approaches to putting together the aims, but you can see how packed all those components of the implementation research kind of critical ingredients are, even just in the articulation of the aims. That's why the aims are so hard to write, is because there's so much that you need to kind of get put together and puzzle together to convey a lot in a short amount of space and grab your reviewer's attention. So study designs, each one of these topics that we're going to talk about today is worth an entire, presentation in and of itself. So I won't get into any of these in too much detail, but rather just focus on thinking about these components in relation to your considerations for your proposals. So as I mentioned before, we, in our implementation research proposals, we're going to talk about not only perhaps effectiveness outcomes, for example, but also about implementation outcomes. And Russ and his colleagues set us up many years ago with REAIM, which has absolutely stood the test of time. And you'll see that many of the components of REAIM are reflected in Proctor's articulation of implementation outcomes a decade or so later. I think one of the most important things to remember about implementation outcomes is that you don't have to assess them all. I think when people see a list like this, they think we have to do everything. We have to do acceptability and adoption, appropriateness, cost, and you don't have to. Sometimes it's not within the scope of your resources to be able to do that. By resources, I mean funding, team, time, bandwidth, etc. And it's perfectly fine to focus on a handful of implementation outcomes. But you need to justify those decisions. So why did you choose those outcomes? What methods are you going to use to assess those outcomes, and why those particular methods? So if you leave anything out, you want to say why you're leaving it out. Maybe cost isn't within the purview of what you're going to be evaluating for particular reasons. These days, cost is very important. So if you're, it always has been, but it's more prominent in implementation research. So if you're not going to evaluate cost, you might need to explain why you're not. Or maybe you're going to have a sort of exploration of cost, but not an entire cost analysis. So if you're leaving anything out, maybe because it's already been done, or you have preliminary studies on acceptability and you don't need to do a whole lot related to that, then you need to provide the justification. You don't just want to leave it out of your proposal and then someone says, your reviewer says, well, why aren't they looking at these other outcomes? So again, that justification is really critical. Another thing to be very specific about in your proposal is your units of analysis. So where is the change going to be happening? It could be happening in more than one place, right? So you might be trying to achieve change at an individual level, but also at an organizational level for example. What we often see in implementation proposals is that the units of randomization, if you have a randomized design, are much larger. So we might be looking at sites or clinics or regions or classrooms or communities. And so that has a lot of implications for your power analysis, for your entire analytic plan. So it's important to be specific about your units of analysis and how you're going to go about demonstrating change at those different units of analysis and what your evaluation measures are to capture the different units of analysis. So more often than not, you've got some combination of both individual and larger units of analysis in implementation research, looking at things like climate measures, performance issues of a clinic or an organization. So you're not only looking at the people, but the settings in which those people are working and functioning. Now, this is, again, a big topic. Every slide I get to, I'm like, wow, we need like a whole half an hour to talk about this. So what I've tried to do is point you to a lot of resources that can help you with these things. I just put in the upper left, go back to the subway if you're wondering where you are in terms of being ready for a hybrid design. There's a wealth of resources cited below and elsewhere that give you lots of information about hybrid designs. I like to think about hybrid design decision-making in terms of what is my primary question or what are my primary questions. So if I have primarily an effectiveness question, I am probably going to opt for a hybrid type 1 design. If I have a balance of questions between effectiveness and implementation, probably going to opt for a hybrid type 2 design, as you saw in the first specific aims example. And if I am primarily interested in an implementation question and maybe secondarily in effectiveness, then I might choose a hybrid type 3 example design. So, you know, your decision-making process can be guided by these resources I've provided here. And if this is something that we want to come back to and talk about later, although time is going very quickly, we can. But I think, you know, starting with the basics in terms of the core papers that are available about making decisions related to hybrid designs can really help you with this. As I mentioned before, and I'll probably stop in about 10 minutes, I'll at least get through theories and models and frameworks and possibly the next section, and then we'll pause and maybe take a little stretch break. So this is one of the more challenging areas for implementation research proposal writing. I think because this may not be super familiar to you if you don't have a, you know, if you're not trained in a discipline that spends a lot of time working on theories and models and frameworks. And, you know, some fields do and some fields don't. It's no judgment whatsoever. It's just sort of a comfort level that people have or don't have with theories, models, and frameworks. Thankfully, again, there is so much guidance available on this, and so much work has been done to make this aspect of implementation research more intelligible. I won't get into the definitions, they're here. I think what I want to skip to for a moment, and I'll come back to this slide in a second, is just why do we need a model? So that's one, to me, to be able to do a good job of using your theory in your proposal, you need to understand why you need it to begin with. And that really goes back to the point that I raised before about the fact that you are trying to change something. And so you need a theory of how that change will occur. And your theory really drives everything, right? Your theory drives what you decide to do with regard to who or what you're targeting for change, how you're going to foster that change, what methods you're going to use. Like, that's why the theory should be appearing in lots of different components of your proposal, because it is affecting your decision making related to all these different components. So the models that we have in implementation help to figure out our processes, and they help us to interpret our findings. Just to go back here for a minute, part of the trickiness of this is that terms get used in different ways. So some people say it's a theory, and some people say it's a framework, and some people say it's a model. And that's just, you know, some of the semantic confusion that's part of the field. The way I think about it is in terms of a theory of how the change will occur. So that is a really kind of specified pathway that I'm starting with to help understand why I think change will happen and how I think change will happen. And a framework will help to guide implementation. And you probably will need both. So framework, if it's not confusing enough. So frameworks often contain theories, but theories don't typically have frameworks, although there are some exceptions to that. Just this is for more information. I won't spend more than a minute here. There's an excellent paper by Per Nelson about making sense of all of this. And he says there are really 3 reasons why we need models. We need to describe processes. We need to understand what influences implementation outcomes, and we need to evaluate what's going on. And so if you think about those 3 aims, there are many different models, frameworks, and theories that help us do each of these things. And those are the categories that you see listed there. So if you say, well, I really want to be able to describe processes, then I'm going to go to a process model and see how that helps me to explain the processes. And so I just recommend going here for guidance, and also to an excellent paper by Rachel Tabak, which I'll cite in just a moment. Now, this is just a heuristic of phased-based research. And what you'll see with many different frameworks, consolidated framework for implementation research, replicating effective practices, Greg Aaron's work with EPIS, with dynamic adaptation process, these all offer a phased-based approach to the work that we do in implementation. You can see that there are different terms that refer to each of these phases, but roughly speaking, there are things that we want to do in implementation before baseline. There are things we want to do at baseline when we're first getting started. There are things that we want to do during implementation, and there are things that we want to do and study and evaluate after and beyond implementation. So you'll see a lot of variations in how these phases are labeled. But the basic idea is that, number one, phases really help you in so many different ways. They are indispensable in proposals because they help you to organize a lot of different information. For example, when are you using different implementation strategies? And I'll show you some examples of that in a few minutes. But they can also help you with things like budget. So even though it's like, well, wait, this is about my study design, when you think about what are you going to need to do when, you think about what team am I activating during different phases? What types of resources do I need? Maybe I'm interviewing patients and I want to be able to compensate them. That's going to happen at baseline. So I need my budget for that to be happening during that time, which I'm going to have spelled out in a timeline. I just realized that I didn't put that point in this presentation. You need to have a timeline, very elaborate timeline. So for me, it's not a matter of saying which is the best framework, which is the right framework. The good news is that there are many available. I would just recommend having a framework that gives you a phase-based approach to explaining and describing the work that you are proposing to do. This is the Rachel Tabak paper, which also helps you to figure out how do you even choose a model. There are several different considerations. Like construct flexibility. Are you doing dissemination? Are you doing implementation? What level are you operating at? Do you want to use an existing model or develop a new model, which I really don't recommend? And a really critical piece of this decision-making process is whether the model that you're interested in has measures or instruments already designed to accompany it. And not all of the measures, not all of the models and frameworks out there do. So there's a lot available. There were 61 models back when Rachel and her colleagues wrote that paper. There are, upwards of 70 or 80 models. I put the acronyms here on purpose just to, these might be familiar to you. You've kind of heard of them and you don't know what they are. Some of them you may know really well. But there are basically a plethora of models available to you. And the great news is that Borsica Rabin and colleagues have put together incredibly helpful resources to help you. So that website that's listed there, you can actually plug in constructs that you're interested in, all of the different issues that I mentioned before, levels, units of analysis, et cetera, and it will say, here are some models and frameworks that might be helpful to you. And I mean, I've been doing this work for a long time, and I still go to this website to see, is there some new framework that I don't know about, or one that might be more suited to what I want to work on now. So, you know, the field is growing so fast and so robustly that, you know, it's very hard to keep up with everything that's out there. And resources like this are just absolutely amazing to help us do this work. And there's also a website at University of Washington that helps similarly with picking a theory model or framework. What I would say is use an existing model, because there are so many. And I think at this point, we're kind of hard pressed to come up with something that someone hasn't already thought of in some way. That's not to say that there isn't excellent, new, innovative, conceptual work going on, but there's just so much available to us that it's really helpful if you can draw on something that's already been designed, yours or someone else's. In a lot of my work, back before there was this amazing array of models and frameworks, I used the program change model developed by Dwayne Simpson for several of my early implementation studies. First of all, it was one of the only ones out there at the time, but it wasn't, I didn't use it for that reason, but for the reason that it includes theory in it. So it includes embedded in it a theory of organizational change. And it also has measures that have normative data that are, you know, really well tested, have great psychometrics, et cetera. So I've found this to be a super helpful model for several studies. And there are others that I'm not bringing up today that kind of fit the same bill of giving me some theory, giving me some phases, giving me some measures, giving me constructs that I think are relevant to what I'm studying, and all of the work and thinking that goes behind having a well-articulated model like this. So what do you do with a model? Well, first of all, you want to figure out pretty early. It's one of the earliest things that you want to be thinking about in terms of how that is going to guide the rest of your proposal. So that's why it's critical to come up with it early and not decide late in the game, oh my gosh, we don't have a conceptual model. That's going to be a problem. You want to be putting this at the very forefront of your thinking, because it affects everything else, as I mentioned before. So you really want to have a good description of what you've chosen. It may again be a combination of a theory and a framework, for example, and how you're going to use it. Or there might be pieces of it that you're not using and pieces of it that you are using. And you want to be clear about why you're using which pieces, but thread it throughout the proposal to help reflect on what activities you're going to be engaging in, what measures you're using, what your analysis plan is. And this is, again, one of the downfalls of many implementation proposals, is that that model only shows up in one space and it's not woven throughout the entire proposal. My pet peeve is when the model does not show up in the analysis sections, both the qualitative and the quantitative analysis sections. So I don't believe in this idea of a generic analysis section. I think if we have a model that has driven the measures that we're using, the way we're collecting data, that needs to be reflected in the analysis plan. So how are those constructs feeding into your analysis plan? If I see, that a proposal has this great framework that they're using, and then they say in the analysis plan for the qualitative data, well, we're going to use grounded theory and come up with some codes and some themes, that's definitely not going to go over well with me or other reviewers, because it has no specificity. So you really want to get to that specific specification of how the components of the model are going to influence your analytic approach. Okay, so I think I'm going to stop there for a minute. Our next topic is going to be strategies. I need to take a breath and also see if there are some questions and comments coming up. And if this is a time that you want to, step away, stretch, take a little break, get some water, this would be the good time to do it because we're at about the halfway point. So Elena, do we have stuff going on in the chat?
Yeah, we do have a few questions that have come in. Allison, when do you want to break until?
5 minutes.
Okay, so we'll start content again. It sounds like at 4:07. All right. We have a couple of questions that came up back kind of when we were talking about efficacy and also the logic models kind of initially. Do you want to talk about those now, or shall we wait for folks to come back?
I don't want anyone to feel like they're missing anything, so
yeah,
I guess we can wait until we come back.
That sounds good. Sounds good. But yes, we have some great questions coming in.
Wonderful. I can't wait to take my time with them because I see some great stuff. I'm going to go off camera for just a minute to stretch and say hello to my dog, who's being very well behaved. I'll be right back.
Sounds great.
Okay, hi everyone. I'm going to get going just because there's so much to do. Thanks for all of your great comments and for Russ and everyone who's responding to several of them with super fascinating stuff that I can't wait to read more about. I wanted to pick up on one point that you made, Russ, about combining models too, because of I just used your REAIM PRISM combined model in a proposal, and it worked really well. So I'm really glad you pointed that out, because that is another exciting direction that a lot of work is taking, is saying, you know, let's blend what we have going on in different models to come up with something that even more greatly enhances our ability to understand what's happening in implementation and specify our outcomes and our constructs, et cetera. So thank you for making that point. And if you feel like putting that reference into the chat, that would be great. Or we can send it out later. So Elena, I'm thinking I should maybe, just based on what's in the chat so far, I'm thinking I should maybe get a little further distance down the road, because some things that people have brought up, I may be answering as I go along. So what I'll try to do is get through the remainder in, oh gosh, maybe 20, 25 minutes, and then we'll leave the rest of the time for discussion.
Sounds great.
Okay, thank you. So another key component of your proposal and implementation research is definitely going to be implementation strategies. I'm guessing most of you know what strategies are, but these are the techniques that we use to enhance the adoption, implementation, and sustainability of a practice or program. Highly recommend, you know, Proctor's paper about specifying and reporting implementation strategies. So what they talk about in this paper is that you have to name your strategies, you have to define them, and you have to specify them. And I put the terms that they use in that paper here. And then it's also, I just have a slightly different way of looking at it here in terms of your specification. So you really want to think through the strategies that you think you'll use. The tricky part about strategies is that you may not think of everything that you will eventually need, but you have to have some. You have to have a starting place and an intentionality behind the strategies that you know you're going to try to use. And then you may have a process for figuring out which strategies were more or less effective, helpful, useful, supportive, et cetera. So you want to have the thought process behind the strategies that you select from the outset and think about their relative complexity. Are you blending strategies? Are you using multiple strategies? You might be, more often than not, you are using different strategies at different times. So you may have, for example, a lot of, like, stakeholder engagement is a pretty big strategy that encompasses a lot of things, but you might have particular approaches to stakeholder engagement in the early stage of your project. And so you want to be clear about what that's going to look like. How are you going to do that? How are you going to actually use that strategy? You may have educational strategies or training strategies that happen at certain points and not at others. So you want to be clear on who the target of the strategy is, who is doing the strategy. And you may have some strategies that your team does and other strategies that are done from within the setting where implementation is occurring. You want to think about when the strategy is being used, and that's again where that phase-based approach can be just basically indispensable to at least start with an idea of when you're going to use what strategies. We also think about how much of a strategy is needed, and sometimes that's going to be tailored to what you learn about the particular settings. So one, for example, if it's part of your design, one setting might need much more of a strategy than another. And so that's something that we try to evaluate and have methods for evaluation of those issues. You also want to be as specific as you can be about how often the strategy is going to be used and how you're going to track or measure, document the use, intensity, relevance, importance, and impact of your strategies. That's a lot of things that you are evaluating just in relation to your strategies. But again, this is a big part of implementation research proposals, and it's something that really needs to be spelled out. I remember in that R01 that I mentioned, that was one of the things we had to go back and fix in our resubmission, was a much clearer articulation of when we were using which strategies and what our rationale was for those strategies. Because at this point, we have a pretty great evidence base for the strategies themselves. We know, for example, that education is usually necessary but not sufficient. So you can't just say, okay, our strategy for this entire project is going to be education. It's not going to, we know it's not enough to tell people, what they might need to know. There's so much more involved in behavior change and in organizational change. These are just some examples of implementation strategies. Byron Powell and colleagues have done absolutely amazing work at really expanding and exploding our ideas and knowledge base about strategies. I wanted to make sure you all know that VA Quality Enhancement Research Initiative has implementation strategy training hubs where you can get trained in several of the strategies that you see here. I lead one on evidence-based quality improvement, and to date, I've been able to incorporate non-VA people into those trainings, and I believe that several of the other hubs do as well. I don't know if they all do, so don't quote me on that, but I know at least some of them do. So if you want to get training on particular strategies that are available through these hubs, I recommend taking a look at what those offerings are. So needless to say, similar to theories, models, and frameworks, there are challenges with implementation strategies. There are a lot of them. So, you have a huge list of strategies to choose from, and we're often not very good at specifying or defining the strategies that we're using, or we maybe use inconsistent terminology. And there's so much work going on now about really articulating what strategies work best under what circumstances. And Byron Powell and colleagues generated a really, really amazing research agenda for understanding the impact of implementation strategies pretty recently. So I recommend taking a look at that paper as well. I'm going to give you just a couple of examples of visual displays of strategies. This is from our Empower Query proposal, where we use the Replicating Effective Programs, or REP framework, which in the literature is considered to be an evidence-based implementation strategy that just happens to have very handy phases associated with it. So we chose this for our program because it gave us a lot in one. I really like using models and frameworks that give me a lot of different things I'm looking for. So not only did this give me a really great set of strategies that I could try to use during each phase, but it gave me the phases themselves according to other work that had already been done with this framework. And we chose to enhance it with multi-level stakeholder engagement and with complexity theory, and provided a justification for why we were adding some strategic elements to the existing framework. Work that I had done a long time ago with my colleagues Alex Young and Amy Cohen, Matt Chinman. We used that. It was at the time called the Simpson transfer model, that program change model I showed you a little while ago. And we just set up the stages that you see on the left with the strategies we were using during each stage and the type of evaluation we were doing during each stage. So this is just an example of how you can set up your information. Visuals like this go a long way in helping reviewer fatigue to see, I've got 3 paragraphs about strategies, but I've also got this great, at a glance version of when each strategy will be used. And so anything along these lines, lots of different examples, but just showing in a more kind of distilled version, what are the primary strategies that you're going to use in each phase and what type of evaluation will you use. That's what we were using here. Sorry. Okay, so methods, another really big topic. I'm not gonna This won't be a training on how you choose your methods for your implementation evaluation, but more an overview of the types of things that you would be expected to address in your proposals. So one of the key things to think about back to your design considerations is how are you going to use your evaluation data? So for example, in a hybrid type 1 design, we typically don't use our evaluation data to inform what's going on during what is mainly an effectiveness study. So that has implications for everything, for how you design the study, when you're collecting data, what type of data you're collecting. And you're not really trying to change what's going on during the course of your effectiveness study. In contrast, typically in hybrid type 2 and 3 designs, you're going to be using your evaluation data to optimize implementation and or your clinical intervention processes. So you're saying, I'm going to find out next month that this is what's happening in these clinics, and I'm going to make adjustments to the implementation processes based on what I'm learning from my evaluation. So that's where this idea of formative evaluation in a slightly different formulation than public health, traditionally referred to, because the evaluation data in this conceptualization is used formatively throughout the project. So again, that has a lot of implications for how you set up your evaluation, for the resources you need for your evaluation, who is doing what at what times, has a lot of implications for analysis, which I'm not getting into today. But the idea is, if you're going to use, let's say, your mid-implementation evaluation data to guide what happens next, you can't take 2 years to analyze that data. You have to have procedures in place to turn around the analyses so that you can use the information from your evaluation in real time in the project. And most likely you have some type of summative evaluation too, that may be focused on the impact of the implementation strategy, could be looking at impacts on processes of care. This might be where you're looking at the economic impact of your strategy, but there's often something built in toward the end that has a more summative orientation, and that might be where you're looking at the outcomes of your implementation strategies. So in terms of what you are articulating in your proposal for measurement and assessment and evaluation, I can't stress enough that this is where your model is critical. So that model that you've chosen is really meant to help you select the characteristics or domains or constructs that you're going to be assessing. So for example, people often use the consolidated framework for implementation research that has 5 domains, multiple constructs in each of those domains. And it really helps you to think about what are the intervention related characteristics that I'm going to study. So maybe I'm going to look at things like how much evidence there is for that intervention, how complex is it? And you see some diffusion of innovation theory built into these constructs, right? How adaptable is it to different settings? Is it better than what people were using before? How much does it cost? These are just examples. These are not meant to be exhaustive, but this is the type of work that you're going to be putting into your proposal thinking in terms of what do I need to measure or evaluate or assess. And the reason why I don't just stick with measurement is that a lot of this work is going to be done qualitatively. Or with mixed methods. So you'll have some combination of methods because typically one method alone will not give us all the answers that we need to understand what's going on in implementation. We often look at things like culture and climate, and when we're trying to understand context. So we look at things like readiness for change, we look at leadership. These are things that we know we have vast bodies of evidence that tell us that these really matter for implementation. So if they really matter, chances are your reviewers are going to want to see how you're addressing contextual issues. There are many, many, many ways of going about assessing context, but the bottom line is you do need to assess context and have a rationale for the way that you're going about assessing context. And of course, people are at the heart of all of this work. We need to know what people know about what we're trying to change, what their attitudes about it are, what they believe, their sense of self-efficacy, for example, individual level readiness. We know things like commitment to organizational mission is very important to implementation. Studies often look at burnout. Again, there are many other things I could list here. These are just some of the growing kind of classic list of things that we evaluate in implementation studies. But just to reiterate, your decisions about the constructs that you're assessing or measuring all need to correspond to the model that you've selected. So you want there to be that visual of your model with the constructs, and then the reviewer seeing, oh, to look at self-efficacy, which is part of that model, they're going to be using this measure, or they're going to be asking this set of interview questions, using qualitative methods, etc. So there isn't one, perfect way to do this. The perfection really lies in that correspondence between the model that you've selected and the constructs that it helps you to articulate in terms of your measurement and evaluation. So choosing your methods, again, very complex, big topic. I think for me as a reviewer, I really want to see the rationale for the methods that have been selected. So if it's heavily qualitative, I love that. But I don't only want to see that necessarily. I really want to think about, I want to see the thought process that goes into the methods that have been selected and their complexity and the way, for example, if you're using integrated mixed methods, what does that mean? What does that look like? How are you going to do that analytically? These are questions that, Greg Ahrens has written amazing papers about and many others. And we can provide more citations if you're interested. But it's not just about choosing your methods, it's about thinking about how you can use those methods in relation to the team that you have, the expertise of that team, how much time you have, how many resources you have, what are the IRB considerations. All of these things factor into our methods decision making, as well as very concrete questions about where do I need data from? Do I need primary data collection, for example? If so, from whom? What's that going to look like? When am I going to use different methods and why at those times and not others? How much data do I actually need? Sometimes we collect way more data than we need, and implementation research moves very quickly. And so I've come to take a much more parsimonious and pragmatic approach to figuring out how much data we need, even knowing there's probably more that I want, but I'm not necessarily going to use it. So I might have to make those decisions. And so you really want to think about these junctures for analysis, especially related back to your design, and how and when, if you are using mixed methods, how and when are you going to mix the data that you have from these different sources. That is often left out of mixed methods evaluations, is how are you combining and integrating the quantitative and the qualitative work. That's a whole other topic about designing and executing integrated mixed methods research. So what I will say just for now is that if you say you're doing an integrated mixed methods evaluation, but then you have no analytic plan associated with the integration, that is definitely going to be a missing piece. You can set up visuals of your evaluation data. This is back from the EQUIP study that we did many years ago, where we listed, the types of data we were collecting, where we were getting the data from, a little bit of the sample content. I've used something like this in many proposals since then. And also you can use your phased model to help line up your methods. And again, this is an approach I use regardless of what model I'm using, where I want to show in each phase what type of data will I have. So here, for example, in pre-implementation, we're going to be collecting field notes, we're going to be collecting documents, we're using a readiness for change measure and a burnout inventory and conducting key stakeholder interviews. So these types of visuals that you can get very creative with are really essential to give your reviewers a break and give them a different way of understanding what you're doing So of course you're going to have narrative associated with your visuals, but a good visual will go a long way in not only conveying what it is you're going to do, but conveying to the reviewer that you're very organized in your thinking. It has that sort of added bonus of saying, I can show you visually what this is going to look like in a very parsimonious way. So, closing tips, that was a lot, but we're getting to the end of me talking nonstop. There are so many more closing tips. I've thought of like 10 since I wrote this slide a few hours ago, but I'll put these out there and then we will have some conversation. So first, I would say, whether it's implementation research or anything else, you want to have a very intimate understanding of the request for applications and make sure that you do absolutely everything it says to do in the way that it says to do it. This means you're going to be going back and forth with that. You're going to be highlighting it. You're going to be making a cheat sheet for it. But this is what your reviewers are using to evaluate your work. So you want to make sure that if it says we need a section on X, you have that section and it's clearly marked so the reviewer doesn't have to search for it and maybe come to the conclusion that it's not there when it actually is. Definitely talk to the program or project officer for the particular RFA, for the institute that's providing the request. That's what they're there for. They are incredibly accommodating people in my experience and have insights that if you don't talk to them, you won't have. So that is part of what they're there for. It's not all of what they're there for, but they are there to help you think through your approach to responding to this request for applications. You want to work on these proposals with a multidisciplinary team. You want to do this work with people you like, because it is hard. It is very hard. It is very intellectually demanding and just time demanding. And you want to do it with people who you can really share ideas with and go out on a limb with and be humble with, so that together you can put together a really solid proposal. But it takes that multidisciplinary willingness to say, well, I would think about this a little differently, and just working with the team. It is very much a group effort. In terms of your way of writing, it's critical, especially in this field, to be very consistent and specific and thorough with your terms. So you don't want to refer to something in one place of the proposal and then it's the same thing elsewhere, but you're using a different term. You want to keep those terms really, really consistent. And this sometimes comes at a later stage in the grant writing, to where you can have someone who's maybe not even so close to it kind of go through and say, well, you called it here, this on page 4, but then you called it down on page 5. Which one do you want? So it can be really helpful to have someone with that eagle eye do that type of work. I would recommend getting a lot of feedback on your specific aims, which is, only a page. So I figure that's not a whole lot to ask folks to do. And the more feedback you get, the more refined that page gets. And that page is everything as far as I'm concerned. I really recommend using clear and meaningful visuals. So it's not just having a visual to have a visual, it needs to be able to tell a story for you and do some work for you in the proposal. They do take space. So you want to be sure there aren't so many that you don't even know why you're looking at so many visuals. But at the same time, you want enough so that you have a break as a reviewer seeing, oh, well, let me just breathe and take a look at this table or this diagram or whatever it might be. Every decision needs to be justified in your implementation proposal. Why did you choose this design and not other designs? Why did you choose this particular model, theory, framework? Why did you choose this strategy, these methods, etc.? As I've mentioned, you want to make sure that your theory, model, or framework is working. It is at work in the proposal and it's very consistently used. And then there are a couple of tables. One is in Ross Bronson's paper and one is in the Crabble paper. They're both amazing in terms of giving you like a whole checklist of things to go through and say, did we do this? Did we do that? Did we do this? We've had a couple of proposals where we just shifted those tables into Excel spreadsheets and we were like, yep, we've done this. Wait, we haven't done that. And so there's just amazing guidance available out there for you. And these are papers that tell you, like, Bronson's paper is about the magic elixir of proposals, and the Crabble paper really focuses on reviewers and how they're actually reviewing the quality of implementation research proposals. Both of those references were back in the beginning. So I just want to close the presentation portion by acknowledging my funders, especially the Hub that is the host of today's presentation, and also the many, many, many people and groups and communities and folks who have been sources of content and or inspiration for basically everything that I shared with you today. So thanks to all those folks and entities, and thank you to all of you. If you need more information or want more information about the Hub, there is our email, and lots of us in this space are on Twitter. There's a super vibrant implementation science community on Twitter that I recommend kind of hooking up with, because you'll see all the papers the minute they come out the door. And I think I will wrap there, and we have just over 20 minutes for discussion and comments. So thank you so much. And I will stop. Well, I won't stop sharing just in case people need me to go back to certain slides, but maybe I'll stop sharing in just a little bit. So, okay, where are we with comments and questions?
Great, great. Well, currently we're getting lots of just very positive comments about the content that you shared, Alison. It seems like it was really helpful for folks. So I'll just go back to the questions that have been entered into the chat. Alison, I know now that we're done with the presentation portion, do you want folks to have the opportunity to ask questions by unmuting as well, or shall we continue to use the chat?
I'm okay if folks want to ask their questions personally.
Okay, sounds good. Well, I'll grab a question from the chat now, but then we can kind of go back and forth if folks have questions that they'd prefer to ask verbally.
Yes, and I know that I am not the only one here who's going to have a lot of great answers. So there are lots of people in the audience who are extremely knowledgeable, and as you've already seen, so I definitely don't need to be the only one answering questions. And so we can definitely continue with folks weighing in with different resources and perspectives. You know, there's many, many experts here from what I can tell.
Great. So one question that we got was, would you comment on how to write the innovation component of an implementation science proposal? They say, my personal experience is that adaptation of an EBI in a different population or setting is often criticized for lacking innovation, and the innovation of mixed methods research or hybrid design is undervalued as well.
Well, it's a really good question. I'm not sure if it's undervalued as much as now it's been done a lot, so it's not so innovative, which is not the best news. You know, it used to be that adaptations were highly innovative, that integrated mixed methods evaluations were highly innovative, that blending models was innovative, and people have done a lot of that work now, so it's not quite so innovative. And then you have very sophisticated reviewers, many of whom have themselves done that work. So they're like, well, that's not so innovative because that's what I did 5 years ago or something like that. So I do personally even find it to be one of the more difficult sections to write of a proposal, because you really have to process and think through what is new and different about what I'm proposing. It could be methodological, it could be conceptual, and that may even weigh into like a design decision. Maybe you're using a design in a different way, or you're using a design that hasn't been used very much, and you have a good case for that, and you feel like it's going to illustrate something about what you're trying to do that, you know, no one's ever done, or that very few people have done, or no one's done it in the way that you're proposing to. I mean, one of the things that we proposed in an implementation proposal not so long ago was an incorporation of more ethnographic methods into the implementation research. It's not to say that it hasn't been done, because it has, but it hasn't been done all that much. And we tried to make a case, which I guess was successful because we were funded. We tried to make a case that these methods were going to enhance methods that we had previously used. So it's also innovation, kind of building on what you may have done previously, or building on what you learned from preliminary studies that took you in a new direction. So sometimes it's innovation in relation to your own body of work, and or in relation to others' work, but it is critical to get some feedback on that section from other folks who maybe aren't quite as invested, to say, okay, is this really innovative or is it not so innovative? And sometimes even talking through what you are proposing, someone listening to it can say, oh, but wait, that's really innovative. I've never known anyone to do that, or haven't known anyone to do it in that way. So it is a bit of a crafty section. I don't know if there are others in the audience who have particular recommendations for innovation and for crafting that section. I might stop sharing because there's one piece of guidance that I can probably bring up pretty quickly that I thought was really strong in innovation pointers. But if anyone has comments while I'm just looking up that really quickly, feel free to bring them in. So I liked this. This is from a VA reviewer guidance. So what they talk about in terms of innovation is the ability of the project to yield results that can be expected, to change practice, influence scientific methods, disrupt the previous order of things, or introduce novel ideas or methods. So what I like about that is that it's very forward-looking. It's about, if we achieve the results that we're trying to achieve, here's what's going to change. So it's not so necessarily, we're starting with this new thing, but if we're successful in what we're doing, it could shift things. It could mean that we do things in a different way. It could influence our methodological approaches. So I liked that kind of distinction between, what you're proposing innovative, or is sort of like the trajectory of it going to bring you to an innovative place. And that can be really compelling for an innovation section.
Thanks, Allison. One of our other questions was, are there any samples of tools that help to track implementation after you get funded? There's a lot going on, and developing an effective system to track meaningful data seems to be challenging. And I think you maybe mentioned something from Lisa Saldana. Can you say a little more about that tool and other tools that might be useful?
Yeah, I mean, we're starting to use Lisa Saldana's stages of implementation completion in our current query program, and we're really excited about it. So what Lisa and her colleagues have set up is a pretty elaborate platform for tracking implementation steps, processes, procedures, that's kind of based in a milestones approach. So things that you have laid out that you expect to happen and that you intend to happen, you sort of set it up based on that information, and then you track the extent to which those things actually happen across sites. And we're doing it. We're actually tracking our implementation strategies because we're doing a hybrid type 3 study. So we're comparing two implementation strategies and tracking our use of the strategies across sites, because it's going to be a really robust way, we believe, for us to understand differential uptake of the strategies and also the impacts of the strategies. Her name is Lisa Saldana, and if you look up the stages of implementation completion, you'll see her work. Russ, do you want to make that comment to the group about the form function? Because I should have included it, you're right.
Yeah, Brian, Allison, you or others might need to help me a little bit here, but Monica Perez-Holes and Brian Mittman, colleagues, developed what I think is a really neat concept that they call form and function. It's related to and parallel to kind of the notion of core components, but I think it's a nice, real easy way to talk, particularly with stakeholders or teams, about what it is that you're doing. And the idea is kind of what's the principle that you're doing here? And are you delivering in the way that you do that, things that are congruent with that? And then that's called the function. And then the form is the specific adaptations that you might make to do that. And there are some tools that they've developed. We can send out the reference or whatever later, but it has this nice matrix that you can use to, I find it useful to kind of track and explain both look at things that are implemented consistent with the model and then what adaptations are made.
Mm-hmm. Yeah, I'm so glad you mentioned that. I really need to add that to this particular presentation, and just more information about adaptation in general, because that does come up more and more in reviews. How are you going to track adaptation if that's something that you're is very likely to happen? And so given that the field is aware of how common adaptation to your intervention and or your strategies, that will usually be a topic that the reviewers will want to see you cover.
Great. Well, thank you so much. Thanks, Allison, and thank you, Russ, as well. We have another question here. It's a two-part question, kind of about the experience of being an implementation practitioner. So the first part is, would you say that implementation research builds the scientific principles for implementation practitioners? And the second part is, what are the key skills needed to be a successful implementation practitioner or change agent in clinical settings?
Well, Kath, those are two really, really good questions.
Very good questions, yes.
I need to think about them for a minute. I'm just trying this on for size in terms of a response. I mean, I think that in training folks in an implementation strategy, which is what I've been doing for a year or so with that hub on the VA side, a lot of the people who seek and take that training are implementation practitioners. So they are those change agents in the clinical settings. And one thing that I've been thinking about a lot is, to what extent do they need to know about implementation research and the scientific principles? I mean, of course, if they're interested, that's great. But I'm not sure that everything that we do in implementation research is necessary for what practitioners do in practice. I think the way that we can support practitioners and support implementation as done through practitioners, is really coming from a growing scientific base. That's, all this work that we're building up in implementation research. I guess what I'm thinking about, and I don't have like a super elegant answer to it, but what I'm thinking about is that the relative need for being explicit about the scientific principles, and do you need those to be an implementation practitioner? I don't think so, or at least I will say that kind of tentatively. I think in terms of being a successful implementation practitioner, which I don't consider myself to be an implementation practitioner. I work with a lot of them, and I couldn't do what I do without them. So those key skills, I can speak to it from a, sort of more distanced research perspective, but not from a doing perspective, a hands-on perspective. But I think a lot of it has to do with understanding how people and organizations change, and how we can foster change, and how we can engage stakeholders at a lot of different levels and parts of organizations to be part of change efforts. So I draw a lot in implementation practice on quality improvement and evidence-based quality improvement, because there's a lot of evidence there for how we help to foster and maintain and sustain change. And the practitioners that I've seen, the implementation practitioners that I've seen, are incredibly good at stakeholder engagement. They are people. person people, something like that. And they are very good with data. So they know how to guide and orient change efforts and quality improvement efforts using data in really interesting and creative ways. There's probably a lot more to it that I'm not thinking of in this particular moment, but the things that come to mind for me are interpersonal skills, relational skills, the ability to work with stakeholders at a variety of different levels of the organization, and understanding how to use data to inform change efforts. But there are probably other folks in the audience who have additional insights and thoughts, and maybe quite different insights and thoughts about that. And I know there's some really, really good papers about this as well. Does anyone have anything to add to that? You can just unmute yourself if you want to speak your answer instead of put it in the chat. I know I can't have saturated the answer to those questions.
Allison, hi, it's Kath. I didn't mean to put you on the spot with that, but we
I love it.
Hi.
Love the question.
We're a writing group that comes out of the NIH NCATS Dissemination Implementation Working Group. And
Cool.
we're pushing the edge on this in terms of connecting implementation practitioners or quality improvement people in the clinical setting, incorporating them as authentic partners in the implementation, research, design, conduct, so that Russ's relevance is so embodied in the research that we do. And the assumption is, or the hypothesis is, that connecting the end user and connecting to their high priority needs to the research that's being done in implementation science will speed the adoption, because we've tailored something to the specific need. And so right now this group is grappling with what is the distinction between implementation scientists or researchers and implementation practitioners, and where's the Venn diagram overlap. So I think you did a very elegant job of asserting the engagement and stakeholder and QI aspects of it. Thank you.
Oh, thank you. It's a great question. It's one that we've been talking about a lot on a few different committees, because the need for training is, it comes from a lot of different directions. And, I think, well, there are some things that I could probably offer to training practitioners, and there are some things I definitely could not offer, and that other people would be well suited to offer. So I think it's a very hot and important and timely set of questions. And I love that you're working on it in that group. That's really, really interesting. Can't wait to see what you do with it.
Great. We have another question here that is about using the IRLM, the Implementation Research Logic Model. And the question states, so in using the IRLM template with dual context, it seemed as though more effort and strategies were evident at the provider level as opposed to the client level. Is that common?
Well, this is actually hitting on a pretty philosophical issue in the field, where historically, from my perspective, as this field developed, our implementation strategies were not as focused on, let's say, in healthcare for now, recognizing that this extends well beyond healthcare, but in healthcare, that our implementation strategies were not as focused on patients as on providers and clinics and organizations. So much more attention and emphasis was placed on how can we change provider behavior and organizational behavior, and that patient behavior change was more in the purview of like health behavior, health psychology. So some of this is like, and this is again my opinion, not endorsed by anyone, it's just my opinion. Some of this has to do, in my perspective, with the highly interdisciplinary nature of this field and how different fields have kind of entered in to this work at different times over the course of its evolution. I mean, I am really personally compelled by the idea of patient-facing implementation strategies. For example, strategies that are focused on increasing demand for evidence-based practices among patients. So, you know, it's one thing if we provide a lot of practices and try to improve quality of care, but if patients aren't going to get it, then they're really not going to be getting that care. You know, if they're not engaging in the system, then they're not being utilized. Or if patients know and learn that there are, you know, really effective ways of treating something or managing something, and they're not getting that particularly effective way, you know, might we do more to increase knowledge and demand on the patient side? Again, my opinion, my little soapbox. There are different perspectives on, you know, where our strategies should focus. I think that observation is super interesting. And if you look at a lot of the strategies, they are not focused on patients. Very few are from the earlier Byron Powell work. And there wasn't a big evidence base around patient-facing implementation strategies, but that's changing and growing. And I think some of that is changing because when we think about stakeholders, you know, so much of the, you know, outstanding work for decades in community-based participatory research, for example, definitely considers patients, community members, and so forth to be stakeholders and to be key stakeholders in the implementation effort. So we can't exactly leave engagement of patients off the table when we're doing implementation work, or at least that's how I think about it. And that's what I try to incorporate into my work, is really thinking about patients as stakeholders, as any other stakeholders, and that it's important for me to engage them. It's just as important for me to engage them as other types of stakeholders. So I think that there's a lot of movement in the area of more patient-facing strategies, and some of the perhaps lack of attention to that historically has been more related to kind of what disciplines are responsible for what activities. And, you know, again, there are probably people who think really differently about that than I do, but that is how I think about it in a nutshell.
Wonderful. We have another question, kind of going back to our efficacy conversation earlier. This question says, can we use efficacy data established for the intervention developed in a different context than the proposed context? So I think kind of in the context of, do we have an efficacious intervention on our hands or not?
Yes, and that's often what we're doing when we take on the effectiveness piece of the research. So we'll say, well, this, you know, couples-based intervention was efficacious in this multi-site trial, and, you know, the evidence is strong enough, just in this case, acknowledging that evidence is a problematic concept, but just to use it for a moment, the evidence is strong enough that we can now see, if we put it over here in this other setting, and change up some of the parameters of how it was originally studied, can we see if it still works? And the way that we ask those questions about does it still work might change, because, you know, what we think about in terms of effectiveness, as Russ mentioned a little while ago, is, you know, effective in what way, for whom, under what circumstances. And so our notions of effectiveness really might expand out once we start to look at the implementation of that intervention in other settings. But you might be, not always, but you might be starting with where it was originally tested and how it was originally tested, with whom it was originally tested, and then, you know, start to ask really interesting questions when you change that up.
Great, thanks, Allison. We have a couple questions about kind of what makes for a successful proposal. One is randomization necessary for a successful proposal? And then we also have one that says that, they've heard that NIH D&I reviewers are now looking for hybrid type 2 and type 1 won't necessarily fare very well. So any comments on that randomization and then also the hybrid models?
I would say that randomization I would really look to the RFA for whether that's going to be prioritized in the proposals. It often is, but you really need to have a justification for the randomization, for the approach that you're taking to randomization. So for example, in our current program, we're randomizing sites to one of two implementation strategies. So we're doing a site level randomization, cluster randomized trial, and had to provide the relevant justification for that decision. And it was prioritized in the program announcement as something they wanted to see. So we felt like, to be responsive, we really needed to introduce that experimental design into our overall approach. I wouldn't say it's always necessary, but you want, as with any proposal, you really want to justify the design, and if there's some reason not to randomize or another design that doesn't involve randomization is preferable and more suitable to your aims, then you need to make a strong case for that. So it's a little bit more on a case-by-case basis. And then with regard to NIH and hybrid type 1 trials, I really haven't heard that as much. I don't know if Russ is still here or if there are other folks here who review for NIH. I mean, I've still seen hybrid type 1 studies getting funded. And I think, at least from my perspective, there's still an important role for those types of studies. But I may not have the latest scoop on what reviewers are looking like. When I review implementation proposals, it's more on the VA side. So I probably am not like the most knowledgeable about that trend. But I'm going to find out. I'm going to make some inquiries about that.
Fantastic. Alison, we are at 4:59 and I think we just got through, if I'm not mistaken, I think we just got through our last question. So,
awesome.
Yeah, so I think we're ready to kind of close out the session when you are.
All right. Well, thank you all so much. Hi, Ron. It's great to be with you. Hi, Jay. Thank you all so much for being here. Have a wonderful evening, and get in touch with us if you need more information. And thank you so much, Elena, for helping me to make this happen, and to the Hub team for all of their guidance and wisdom. So thanks, everyone. Take care. Have a good night.